think that's the right date. Hi, I'm Rundy Murphy, an epidemiologist and the Director of Disease Surveillance here at the Mobile County Health Department, here with our daily COVID-19 update. The number of cases worldwide are really getting to some really big numbers, as my nephew would say. So worldwide, over 11,600,000 cases of COVID-19 and nearly 540,000 deaths. In the U.S., we're approaching 3 million cases of COVID-19 with over 130,000 deaths. And this morning, Alabama was reporting 45,263 cases with 1,007 deaths. So just going over the 1,000 deaths mark for Alabama. Again, the number of deaths this morning, 1,007. In Mobile County today, we're reporting on 4,246 cases of COVID-19. Yesterday, 92 cases were added to our case count. Cumulatively, 310 people have been hospitalized at some point in their illness, and 140 have died. Those numbers are up slightly. You'll see as our numbers increase, sometimes we add cases to the few prior days. So if you do the absolute math every day, it doesn't always add up. But again, that's because we sometimes get reports in that were added to the days, in the last week or so. Still, we are seeing quite an increase in the average number of cases reported daily, up around 80 cases per day, looking at the 14-day moving average where, just as long ago as, early June, we were seeing only half of that, with about 40 cases added on average each day. Let's see, we had some questions that have asked a little bit more about some of the data. One is it possible to have contracted the virus 4, 5, 6 days before testing positive? Is it possible to test negative if you do have it? Like perhaps testing was done too early. Yeah, so I've been trying to explain to people how this can work. Once you are exposed on day 0, on average, you will test positive or start showing symptoms between 2 and 14 days after exposure. If you get tested on days 1, 2, 3, or 4, it's very likely that even if you were infected on day 0, you may test negative due to a false negative result. When you're infected with the virus, it depends on how many virus particles you inhaled, but those viruses have to replicate in your body to a level that they can be detected by PCR on the specimen from your nose. And that takes a few days. So what we at the health department have been saying, to avoid false negative test results, if you have been exposed, don't get tested before day 5 to 7. Kind of giving you a window there in case there's a weekend or a Sunday when it's hard to get tested. If you were exposed, wait 5 to 7 days for your first PCR test, and you have to be quarantined the entire time. And regardless of that negative, regardless of the result, you have to continue staying home through 14 days, and then we want you to get tested again on day 12 to 14. 2 consecutive negative tests is evidence that you don't have coronavirus at that time. But yes, it is possible to have the virus in your body and it be too low to be detected by PCR laboratory tests. So again, if you're unsure, call us or send us an email at covid19@mchd.org, and we will consult with you about the proper timing of those test results after you have been exposed. All right, next one is case counts are on the rise. Yes, they are. An alarming rise in the number of case counts, almost doubling daily what we had seen when we were under the safer at home order. But recently, hospitalizations and deaths I had been reporting were declining. And this is attributed to a delay in the number of hospitalizations and deaths attributed with cases that are being counted now. So if you are just now COVID positive and you just got sick, depending on your immune system and how much virus you got, and how, any underlying conditions that you might have, or depending on your age, it will take several days for you to develop symptoms. Most people develop symptoms around day 5, but it can happen as little as 2 days and as many as 14 days. But it takes some time before you become sick, and then there is a delay, and the caused by, you'll be sick for a couple days before maybe you need hospitalized care. And then once you are hospitalized and those life-saving measures go into effect, there's then a delay for people that then pass away from COVID infection. So that timeline can be many weeks. So it will be some time before we begin to see the true effect of hospitalizations and deaths on the people that have been reported as COVID, the record number of cases reported in the last 10 days or so. But keep an eye on it because it will go up. Let's see. I just want to comment, in the early stages of our outbreak, also, we had a lot of hospitalizations and death attributed to outbreaks in nursing homes. And we're not seeing that happening as badly now as it was happening in late March and early April. So that also is contributing to there being a reduction in the hospitalization rate and the death rate, even though we are seeing a lot of cases. Most of the cases now are happening in younger age groups that will likely have mild or asymptomatic infection. So there was a comment here about passing the COVID testing center, that there was a long line for testing, and I've been making statements that I'm concerned not enough people are getting tested, but there are plenty of testing centers in Mobile County, around the county. If the line is long at the Civic Center, then call our information line, see if you can get an appointment at no cost to you at any of our locations around the county by calling 251-690-8889. That number is very busy on Monday, and we do know that call line, that appointment line gets overwhelmed, particularly on Mondays following the 4th of July holiday, because people get really nervous when the new week starts, and they think they want to get tested because they misbehaved over the weekend maybe. So we realize that causes some frustration on Mondays, but we believe there's enough testing available in the county. Maybe we just need to try to get people to spread it out a little bit more. And we always see long lines and high call volume following a long weekend when people are out and about and observe that there is a very little social distancing and face mask wearing with people celebrating on the holidays. Let's see, there was a question about, are we starting to run into problems with bed shortages? It is true that the percent available beds is going down, and it is very low right now, maybe lower than we've seen it since this began. Part of this is due to, resumption of non-essential procedures and surgeries, and the hospitals, opening back up to those types of procedures. But we also know that a lot of it is due to new cases of COVID that are being seen at the hospitals. So we're really concerned about this. Again, we ask you to wear a face covering when you're out to prevent spreading your germs. If you're young and healthy, have mild illness, you may not even know that you are spreading COVID out in public. So please wear a face covering and distance yourself by 6 feet, wash your hands, stay at home if you're sick, to try to protect those in our community that are vulnerable to hospitalizations and deaths. There was a comment on Facebook that I believe we have answered by email already, having to do with the counting of cases. We get asked a lot of questions about how cases are counted, because lots of people would like to attribute they would like to sort of say like this rise in cases isn't real, it's really due to X or it's really due to Y, and none of those things are true. So this question has to do with when someone in a household is lab positive for COVID, they are counted as a case. And when the investigator calls you to talk to you about the fact that you tested positive and to talk, find out your underlying conditions, when you might have gotten exposed, when your symptoms started, they're going to ask you who you've been around, who are your household contacts, who are your intimate partner contacts, who are your coworkers that you were within 6 feet for 15 minutes or more, and all of those people are considered your contacts. So the case is counted as one case. The contacts go into our database as contacts, not cases. They go in as contacts. And then we will follow up on all of those contacts, usually within a few days, sometimes as long as a week, to make sure the contacts are staying quarantined like they're supposed to, and to find out if they have developed symptoms or had a COVID positive test since we first knew that they were exposed. If after exposure a contact tests positive or develops symptoms, then they become a case and are counted. So when we have one case in a household of 5 or 10, we do not count the entire family as a case. We count the case as a case, and the rest of them are counted as contacts until they become symptomatic or if they test positive, and then they're counted as a case. So I hope that helps. All right, can the mucus swab test differentiate between a common coronavirus and SARS-CoV-2? I think you're talking about the nasal swab, and the PCR test is specific to the SARS-CoV-2 virus that causes novel coronavirus. So the PCR, the FDA emergency use authorized test that is recommended by CDC and is utilized by the state lab and the other commercial laboratories, the PCR test, it can distinguish between common cold coronavirus and the virus that causes COVID, novel coronavirus. What if you still have no sense of smell after having COVID? I don't know the answer to that question. You may need to talk to a healthcare provider about that one. I'm not recalling any reports that your sense of smell may never come back or may take weeks to come back. I'm not really sure. So please check the medical literature and maybe check with your provider about that. Someone asking about the age summary of people infected in Mobile. I think that was answered online, but I can give you a breakdown. So of our cases today, 103 or 2.4% were 0 to 4, 790 or 18.6% were between 5 and 24 years old, 1,621 or 38.2% were between the ages of 25 and 49, 954 or 22.5% were 50 to 64, and 778 or 18.3% were 65 and older. So again, this is in our daily report that's posted daily. You just have to look on the second page. And we report that this information gets refreshed every day, Monday through Friday. It's remained fairly stable, except that this 5 to 24, 24 to 59 age group, that those percentages are bumping up. I mean, it's half of all of our cases now are in that younger age group. So as we see more and more community transmission in these age groups, we see the proportion of older people going down. So that's just kind of attributed to the math. When you have the percent going up in one category, it naturally has to go down in another category. Here is a question about PCR test being performed. Multiple cases of people who have symptoms are getting negative tests. How accurate is the test, and what about the negative test? So I already spoke to this a little bit. The PCR test is very accurate. If the test is timed appropriately and the specimen collected appropriately and the specimen preserved en route to the laboratory and the laboratory machine working the way it's supposed to. So there are a lot of caveats in that, but for the most part, it's really, really good. And a situation where you might have a false negative is what I described earlier in this broadcast, where your specimen may have been collected too early in your infection. So if that specimen is collected before you start showing symptoms or before you have had 5 to 7 days post exposure, you may have a false negative test. This question asks specifically about people with body aches and loss of taste or smell who are receiving negative results. There are other reasons for body aches that are not caused by COVID. There may be other reasons for loss of taste and smell also. These are not just symptoms that happen with COVID, but these are some that are known to be associated. So we just tried to lower the bar. But if you're having, symptoms like body aches, and you're receiving a negative test, it could be that those are being caused by some other virus or some other reason, maybe an allergen, things of that nature. So you could always wait a week and get tested again. Once you have 2 negative tests, then you're confirmed COVID negative for that point in time. And then there was another question that came in late about, I can't remember. Oh, I know what it was. Hospitalizations. Yeah, someone from the media didn't read the report and sent the question to me and said instead to say, of people who are hospitalized, what is their duration of stay? And on page 4 at the bottom, it states that patients with known hospital admission and discharge had an average hospital stay of 9 days. But it ranges greatly from overnight or just a couple hours to many weeks, 4 to 6 weeks. But on average, it's 9. There's a slight typo I need to correct right there in my language. All right, last thing for today is we are resuming rabies clinics, drive-through rabies clinics. I want to let you know that there are 2 this weekend. One is on Friday, July 10th from 10 a.m. to noon at the Mobile County Animal Shelter on 7665 Howes Ferry Road in Mobile. Again, 10 to noon on Friday. Drive-through rabies clinic, and the cost of the 1-year rabies vaccine is $12. It needs to be paid in cash. The second rabies clinic this weekend is July 11th, 10 a.m. to noon at Pet Supplies Plus on 803 Hillcrest Road in Mobile. Again, drive-through rabies clinic, cash only, $12 for the 1-year rabies vaccination. And just to remind people that animal bites are a reportable condition in the state of Alabama. And if we hear that your dog or your cat or your ferret has bitten someone, we are obligated to conduct an investigation. And if we find that your dog or cat or ferret is not appropriately vaccinated, the animal will have to be quarantined to make sure that they are not carrying rabies that has exposed someone through that interaction, that bite. And just remember, keep your dogs leashed when you're out, and make sure that your fences are dog proof and cat proof and ferret proof. So that's all for today, and I'm not sure if or who will be talking to you tomorrow, but if I'm not here tomorrow, then we'll definitely see you on Thursday. Thanks, everyone.